Thanks to our episode sponsor, Escoffier School of Culinary Arts. Have you ever dreamed of a career in the culinary world but wondered how to make it work with your busy schedule? Escoffier's online culinary program could be the perfect fit. Imagine building the skills of a professional chef right from your own kitchen. Each week, you'll dive into course content with readings and videos, join live discussions with chef instructors and classmates, and submit assignments complete with photos and feedback. You'll also complete an externship in a professional kitchen, giving you real-world experience before you graduate. To take the next step towards your dream career, download Escoffier's Culinary School Preparation Guide to see if it's right for you. Just head to escoffier.edu/culinary medicine. That's escoffier.edu/culinarymedicine. And now for today's episode.
We want to live full lives. We want to live lives with purpose. And I tell patients, please separate your happiness from the number on the scale, from the weight, because you're allowed to be happy no matter what body you're in.
Welcome to Culinary Medicine Recipe. I'm so happy you're here. I'm your host, Dr. Sabrina Falquier. I was a primary care doctor for 16 years and went to school for 4 years to specialize in culinary medicine. In this work, I get to combine my passion and expertise in both medicine and food to teach people about food as medicine and to empower them to understand what ingredients optimize health and also how to cook those ingredients to make delicious meals. On this show, I interview top chefs, doctors, healthcare visionaries, and food service professionals who are making great strides in the field of culinary medicine. Join me as we continue to explore the amazing world of culinary medicine, where I will empower you to make changes to your health and wellness with great food right away. Welcome to Season 2 of the show. Today's episode is about weight management. Did you know that in January is when 40% of people start dieting? January is often a time to make good on those New Year's resolutions. And if weight loss is one of them, GLP-1s such as Wegovy and Ozempic may be on your mind. So today we're going to be talking about weight loss and what has become a commonly used tool to achieve that weight loss medications, and also to clear up some of the misinformation that's out there. I welcome Dr. Nisha Patel, who trained in the same hospital as me in San Diego, California, and has gone on to become a specialist in multiple areas with an extensive resume and bio that is quite impressive. Today, we will dive into her specialized work in obesity medicine as well as culinary medicine. Welcome, Dr. Patel.
Thanks so much for having me. So excited to be here and talk to you about all of this.
I'm really excited. I know it often takes a while to get on the same schedule, and I really appreciate us being able to have this conversation.
Yes, absolutely.
All right, we're going to dive in. So the conversation surrounding weight loss medications can be quite triggering for people. What is your opinion on medicated weight loss and prescription medications for this? And to who would you recommend it?
That's a really great question. And so, we are really fortunate to have multiple different tools to help our patients improve their health outcomes, our patients with obesity, their health outcomes and their quality of life. Both of those are very, very important. And, I often see a lot of dichotomy in conversations around weight management. Is it lifestyle factors only? Is it medications only? And I would really challenge everyone to understand that these are all tools that work together to help people improve their health and achieve their health goals. And so, as an obesity medicine doctor, I definitely use medications for weight management, medications to treat obesity, the chronic disease of obesity, in conjunction with health promoting lifestyle. It's very important to understand that, health is just more than a number on the scale. It's about our physical and our mental well-being. It's about what we eat, the way we move, our sleep, how we interact with others in society. And so I definitely, look at all of those different aspects, but medications are absolutely a tool because we understand that there's underlying neural hormonal dysregulation that makes it difficult for people to really achieve weight loss. And specifically, when we talk about weight, we're talking about reducing the percentage of body fat that we have, especially visceral adiposity. That's a medical term for the fat that sits closest to our internal organs and in our abdomen. That is particularly problematic when we talk about diseases like heart disease and diabetes. So, these are a tool. They're definitely not, an end all be all. They're a treatment for chronic disease. And so we have to make sure that they are used appropriately and correctly. And unfortunately, there's just still a lot of misinformation, which I'm hoping that we can bust in this podcast episode so your listeners can really understand how these are a tool to really help them.
Thank you, Nisha. I'm going to use your first name because we're friends. It
Yes,
feels too
yes,
formal to go otherwise.
absolutely. Yeah, I know. Exactly. Yeah.
So I appreciate that you're having our listeners hear that obesity is a chronic disease because
Mhm.
often that's not known. And when you talk about this tool, the medications, let's start from the beginning. So, how would you explain what a GLP-1 is?
So, GLP-1 is actually a hormone that our body produces in response to eating food. Unfortunately, though, our own GLP-1 actually breaks down really quickly, meaning that it's not active for very long. And so it really can't do the same things as what a medication like a GLP-1 receptor agonist can do. This is a pharmaceutical medication that has a very long half-life. I mean, there's definitely ones that are daily dosing, but the ones that we really think about when we talk about weight management are the ones that are once a week. And so the medications are lasting for, the entire week in most people. So that's just, again, something not our own body can do. We have GLP-1 receptors all over our body, but we know when it comes to weight management that one of the primary places that it's working is actually our brain. Our appetite regulation systems are in our brain, and they're receiving signals from all different parts of our body, our gut. And unfortunately, in people with obesity, the signals they might be dysregulated, or they're not really working as efficiently. And the medications actually help restore some of that signaling, or what I often call level the playing field, so that people can feel like they're in better control around food. Their cravings are improved. They feel full. We understand again that this is helping that biology. It's not taking away the biology. It's not reversing the biology, but it's really trying to help level the playing field. And so these medications are definitely a very useful tool. We also understand that they're just, they often get dubbed into the category of weight loss medications, or that's what they're used for. But we're actually learning that they're helping improve a number of different health outcomes. So it's not just about the weight or the body fat percentage. They could help conditions like sleep apnea, MASLD, which is termed fatty liver disease, kind of colloquially, help high blood pressure. Of course, we know that they help diabetes. And so we are really starting to understand and get that data to help support, the improvements in these other health outcomes, and hopefully, broaden the availability and insurance coverage that patients can have. So I call these medications actually cardiometabolic medications. And that's not a term that a lot of people are familiar with, but we do use that term because we understand that conditions like diabetes, heart disease, obesity, fatty liver disease, chronic kidney disease in some cases often travel together in patients. They might have multiple of these conditions. And when we treat the underlying excess body adiposity or body fat, we're really helping improve many of these conditions. And they're also working in these different areas in our body to try to also help too. So definitely want to emphasize that they're not just weight loss medications, but definitely want to think about all these other quality of life improvements and health outcomes.
Often what gets people in the door is wanting that weight loss and realize the
Yes,
conversation is much broader than that.
bravo.
And one of the first things you mentioned is how it affects the brain. And I want us to dive into that a little bit more. There's a lot of really interesting information that's really come out, how people using the drugs have been, I say, inspired. I'd love to hear, what does it change in the brain that often you hear people changing their relationship with food to be healthier? I've heard anecdotal stories of people now being able to, who live in big cities, of being able to walk from work to the subway where they pass multiple fast food restaurants and could not resist going in there. And now with the
Mhm.
medications, they can. So if you're willing to dive into what's the
Mhm.
science behind some of those findings that we're seeing?
Yeah, we know that, no two people are the same, and there is definitely a lot of individuality in experiencing obesity and how that manifests in our body. So we know that when we look at genetic variations, or, what's the differences from person to person, there's actually quite a few genes that play a role in that appetite regulation. And, everyone's different, right? Like no two people's genes, unless you're identical twins, are completely the same. So we understand that it does decrease what we call food noise for a lot of people. So you've probably seen that term thrown around. What is food noise? It's that constant chatter about food. What am I going to eat? When am I going to eat it? What's it going to taste like? Ooh, that thing is on the table. I really want that. It's that constant rumination about food that a lot of people have. And, when we talk about taking somebody who is vulnerable, who has that biology, and we put them in the current environment that we all live in, which is a really challenging one to navigate, right? There's food everywhere. A lot of it is calorie dense or it's higher in calories. It tastes really good. It's very easy to overeat. Like I always joke and say, no one's overeating apples, but we could overeat a brownie pretty quickly, right? It helps with leveling the playing field and really cutting through that biology so that people they're not having these strong cravings, for example. Like I have patients tell me, like, I went to a holiday event recently and I was able to walk past a table of desserts and I felt I had, a small piece of something and I felt satisfied and I didn't want anything else on the table. And that is not something that they were able to do previously. And so, as you can see, that really did help them make more health promoting, mindful eating habits, even though they were around all of this food. One of the other things that often people are surprised by is that they get fuller quicker. I have patients that have told me, like, I just come from a family where it's like really hard to feel full. Like, we have to eat a certain amount of food, which would make them uncomfortably full to feel full. But now they're able to actually eat a smaller portion of food and actually feel full and satisfied. And so it's actually really liberating for people because they're like, whoa, I have never experienced this. Is this what it's like to be normal? Like, I've actually heard multiple people say that to me or patients say that to me. And it really does help them because they see that the weight is coming off. And so they're even more motivated to start moving more, to exercise more, to work on their sleep hygiene, to set those boundaries and there's, work on stress. Like all of those things come into play when they start seeing the results because it's, a lot of people grew up in strong diet culture, like in the 80s and 90s, even before that. And there was a lot of, really negative messaging about weight and a lot of marketing of weight loss supplements, treatments, programs to even children. Like many of our patients have adverse childhood experiences where they were bullied or they were, taken to certain organizations when they were younger. So it really helps them improve their relationship with food so that they can make those health promoting eating habits.
So, as you're talking about using this as a tool and somebody is using it and seeing these changes, what is the ideal team of professionals and setup to help? Because it's not just a piece of paper you're giving them as they walk out the door. What does that look like while they're on the medication? And then part B of that is going to be how do you bridge them off the medications?
I always say in the ideal world, I wish that every patient had access to a medical professional, a doctor, another healthcare professional that's very comfortable with prescribing medications and understands the science of obesity, a registered dietitian who feels very comfortable with, helping patients improve their relationship with food. And I would say largely many dietitians feel that way, especially helping patients from a wide variety of backgrounds with weight management, an exercise physiologist that can help them, patients at all different physical activity levels find what works for them. Many of my patients can't do certain types of activity. The weight loss will help improve their activity levels, but they can't do certain things, but maybe they can, do seated exercises. But again, you need guidance to be able to do that. A therapist, a lot of my patients, again, have suffered from adverse childhood experiences, a lot of stigma, bullying that they've experienced because of obesity. And so they are still working through a lot of that. And of course, there's life stressors. I mean, there's a lot going on, in the world. And it's especially, I just became a parent over the last year, and I can now fully appreciate the struggles of a working parent and trying to not only take care of their family, but take care of themselves. It's really, really hard. And it's hard for me, even with all the resources. So definitely, somebody that they can actually talk to and kind of help work through some of those things. And then I would actually say somebody who is trained in cognitive behavioral therapy for insomnia. Many of our patients actually struggle with sleep disorders and difficulties with sleep. And I would say that I wish, people had that access to individuals that could help them work through that. And so And that's something that I'm very interested in. I'm pursuing some sort of like pursuing some training in next year, but trying to bring that at scale. Now, that's the ideal world. I will say most healthcare systems and clinics and programs don't have all of those resources, but at the minimum, we definitely need a registered dietitian. And so, I would love to have everyone else. And that's something I've been working on as well.
And how does your culinary medicine specialty fit in with your
Yeah.
work?
Oh, yeah, it's an everyday thing. I mean, I am constantly talking to patients about food, and it's not just like eat this, eat that. That's kind of been, traditionally what patients have heard, whether they read something on social media or the internet. It's like what not to eat, right? It's really about celebrating the joy of health promoting foods, finding ways to improve your relationship with them, and learning how to prepare foods that are enjoyable and just tasty and something that you look forward to. And I often tell patients my own story. I grew up as a vegetarian, but I did not eat like 90% of vegetables. I think like carrots and like a few other vegetables were like what I just didn't know like how to prepare them. I never cooked. I never did any of that. And it wasn't until like this big, beautiful journey in culinary medicine where I'm like, my sister still looks at me to this day and she's like, I can't believe you eat all of those vegetables now. Like what, it's like such a big change for me. And so I love talking to my patients about, I give them little recipes, I give them little tips and tricks to try. I'm hoping to actually incorporate some more culinary medicine education in a more formal capacity. I mean, I've done a lot of teaching to trainees, to the general public, to kind of patients and outside of this capacity, but definitely working on curriculum for my patients in clinic because I think that is the missing piece of the puzzle. And you know this more than anyone, Sabrina, with your wonderful work that you've done over the years. I mean, when patients get that confidence in their culinary literacy, their life changes. And it's so beautiful. And like, how do we bring that to health systems? How do we bring that to our, future generations of healthcare professionals? I mean, that is the dream. And so definitely doing things in more of a bite-sized fashion right now. But I mean, I just love like I have all these things that I make and bring to work, and I put them on my desk, and I show patients. I'm like, look, I made overnight oats, or I like roasted these veggies, and this is what I did. And then patients will come back and say, hey, Dr. Patel, I tried that chili recipe with all those vegetables that you recommended, and it was really good. And they get a little confidence, and then that's how I mean, I went from zero cooking like if you looked at my fridge in residency, you'd be like, oh my gosh, there's just caffeine in there to like making 90% of my meals at home. I mean, that is a huge change.
It makes me think of that target of no matter where you are in your training or life, of having to start at the center with yourself and then trickling it out. So, from your life
Yeah.
experience, how your patients are able to learn from that. And that word celebratory, because
Yes.
there's so much restriction, and to come from a place
Mhm.
of empowerment. And I'm hearing that in how you're working with your patients. So, how, speaking of empowering, so you're empowering, and then these medications are not forever, I assume, or are they?
So, good question. In the majority of individuals, these are going to be long-term medications. In fact, we know it's a chronic disease and we're not treating like we're not rewiring their brain. We're not, changing the underlying biology. I wish we could. I think that there's some, potential for therapies in that range that maybe we'll see in my lifetime, hopefully. But, once you stop medications, it's like taking medications for diabetes or high blood pressure. Like if you just stop them, like things are potentially going to get worse. I mean, we know that I always say weight loss is really hard, but keeping your weight off in the long term is actually harder because of those changes that happen. Our body doesn't really love weight loss. Whenever people lose weight, they might feel hungry or their food seeking behavior increases. They feel less full. Metabolism also does slow down to some degree. And that could vary, from individual to individual based on a number of factors. So it's not a free for all, like you just kind of take it for 3, 6 months, lose the weight, and then like stop it and then you're going to keep the weight off in the long term. I would say that the majority of my patients that have been on medications for years now don't want to come off of it. They're like, nope, don't rock the boat. My life is so different now. I can go on that 10-mile hike in the Sierras with my best friend because I've lost 40 pounds and they don't want to rock the boat. So they are long term medications. I would say that if for any reason somebody has to go off of them, definitely want to do it under medical supervision. There have been situations where people might stop medications without informing their healthcare provider and they're at risk of regaining weight, and we don't want that to happen either. We want to have a plan, but I always counsel my patients when I'm starting medications that they're long term. These are not something that I can never promise you can stop medications and then, keep the weight off in the long run. So yeah, it is sometimes it's hard to really kind of think about taking something long term for weight management, although I would argue that a lot of people wouldn't maybe think about that for blood pressure or something else. And it's, again, I think it's because of the stigma associated with our body weight, shape, and size, and kind of societal expectations on what is healthy and what is not based on what somebody looks like. And we're really trying to move away from that and help people understand that no, this is not about just the number on the scale or the way you look. Like there are other things to consider here, other health outcome improvements. I think that if somebody were to stop medications for any reason, could there be a period of time where they were able to keep that weight off in the long term? Sure. But then, just like in a situation, if somebody is experiencing depression, and of course, external factors, I mean, there's true biology there, and then obviously there's environmental factors. If this individual that is now off of medications, maybe they've been maintaining their weight off for 6 months, 12 months, now they encountered a stressor, they had a baby, somebody died, there was a car accident. I mean, when I talk to patients about the contributors to weight gain, oftentimes these things come up and you can see that they've lost some weight, they've tried, and then something happens and it comes back on. So, this is where the medications can help, at least in the setting of a stressor, really help keep a cap on the biology from, you know, wrecking havoc again, unfortunately, because it's hard. Like if you have an injury, I mean, that's a really common cause for weight gain. Your physical activity has now gone down, which is a part of your total energy expenditure, and you're not burning as many calories. And so now that equation is shifted. It's not as simple like, eat less calories, move more situation. Again, there's hormones and biology at play, but you're clearly not burning as many calories, and then people notice the weight comes on, or they have a stressor, like if they do have depression, right? Like, people may use food as a coping mechanism, and it could be hard on them when they have depression are seeing weight gain, which could exacerbate their depression. So further potentially. So I think it's important to, again, go back to the point of like, this is why these are long-term medications for the majority of people, because that biology is still there and life happens. That's the thing. We live in a really stressful world. It is a very stressful world. I mean, again, I'll use the parent example because I have a special thing for my parent patients because now, like I said, I understand what they're going through. But it's like you drop your kids off to school, you go to work, you forget your lunch at home because you're running out the door, and now, you're at work and you're hungry, and like there's nothing in the break room, and like it is really challenging. Not impossible, but definitely more challenging. So we have to understand that this is real life. In an ideal world, we'd all have 5 hours a day for our well-being, but we don't.
When patients come to you, how how often does a conversation take place of helping the patients understand what we've been discussing, that it's a chronic
Yeah.
medication rather than kind of that 3 month to get to the ideal goal for an upcoming wedding or to fit into jeans that haven't fit in 20 years or whatever the impetus is for wanting to lose weight?
Yeah, I have that conversation with every patient. So when I meet a new patient for the first time, we go through their history, we understand their health history, kind of what were the contributors to weight gain. Then I actually pull up pictures of the brain, the gut, and adipose or fat cells, and I explain that there's these communications that are happening. This is what's happening. And you can see in many of the patients, like the light bulb, the aha moment, like, oh, I had no idea that this was happening inside of my body. And then that's when we launch into the conversation about medications, what their place is in their treatment plan, and that they're long term. And so I always have that discussion. I'm never here to push medications on people or say you shouldn't take medications. I really want to be a partner in my patient's care. So if patients need time to think about it, I give them that time. It's not like we just prescribe and I send them on their way. They come back and follow up. I also support patients that are like, hey, Dr. Patel, I really just want to try like with lifestyle changes to, work on weight loss. And I still follow those patients. It's not like, okay, bye, see you later. Like, come back to me when you want a medication. Like that's not the conversation that I'm having. I will see them. We'll try things. I would say the majority of people end up wanting to go on medications eventually, but I make sure that patients have the space to make that decision for themselves because I don't want them to ever feel like it's we're a partner in their care. And so it's shared decision making, which is, that medical term for being a partner in your patient's care. So it is really important, but I have it with them every time, I meet them for the first time. And then also I'll periodically talk, remember medications are long term, or if it comes up, maybe they forgot, because again, there's a lot of information that's given in that first visit. It's something that I continue reiterating. And like I said, when patients are in their weight loss maintenance mode, which is where they're just trying to keep their weight off now, they definitely don't want to rock the boat.
I imagine in that conversation, a lot of it has to do with diving into the person's why, right? So why
Yes.
are they there to discuss weight management, weight loss options?
Yeah, no, absolutely. Yeah.
So now we talked about all the amazing things about these medications, but I assume there are some negative side effects. Will you go into those a bit, please?
Yeah, so side effects are real, and we never downplay them. I also have that conversation with patients too. They'll ask, what are the most common side effects? And they are typically what you see reported in the clinical trials for these medications. They're GI side effects, nausea, constipation. I tell patients I never want you vomiting. If you're vomiting, I need to know. Um, Diarrhea less often, but still can happen. And then there are others. So I definitely counsel patients, but just like there's inter-individual variability between our biology, there's also inter-individual variability in response to medication. So no two people, just because this person has side effects doesn't mean that this person's going to have side effects. And so I wish there was a way for me to predict based on certain characteristics of that patient's history, and maybe they're just who they are, but I can't. So I go through all of it, and then I tell patients, like, just take a note if you think, if something's happening to you, like after you started the medication, like, I need to know. This is where that open line of communication is really important. And we try to work through some of the side effects, like the nausea. Some of the GI side effects tend to get better with time. We just have to give the body some time to adjust to the medication. And some people it doesn't. And then we stop and we try other medications or we try alternative treatments. And so I never downplay the side effects of the medication. I think that's doing a disservice to patients because they should understand that no treatment is without its downsides. But I often put it into context of we know what happens to people when they have excess, what we call body adiposity, especially visceral adiposity, long term. We know that that raises their risk of many, many conditions. Many of my patients already have those conditions. And so I think in most people, the benefits outweigh the risk, but understanding that there is still risk.
So if somebody is having a side effect like nausea,
Mhm.
and that's something that they want to stop right away, how long, and I realize each individual is individual, but what's the usual time course to see if it gets better?
Usually within a month or two that people start noticing improvements. It's everyone's a little different. Like some people only have it with like their first injection and then it kind of goes away. And then some people notice that it's getting better like over the course of a month or two. And then some people are like, okay, with each every single injection, they're really starting to feel it. And so, we try different things. Sometimes we definitely go through their dietary history and make sure that there's not any dietary contributors to the nausea. We know that if people eat past their new satiety, if they eat, to kind of that more, not Thanksgiving full, but if they eat more than they intend to, or can, I should say, because they're on medications, like they're not going to feel very well. We know that people don't really tolerate higher fat, really greasy foods on the medications. Sometimes changing the injection site, anecdotally, I don't have a study to prove this, can help with some of the symptoms, like from the abdomen to like the arm or thigh. Sometimes we have to support them intermittently with medications for nausea, but just understanding that we don't, really don't want them just to be on the nausea medication forever and ever. So there's definitely things that we can do. Make sure there's no other medications that are contributing. So a lot of this is why, the prescriptions have to be in people are written by people that feel comfortable with managing these side effects and really thinking critically about the side effects too, instead of just kind of like handing a patient a medication and saying, okay, I'll see you in like 6 months or a year, because that's not really the longitudinal care that patients with obesity need. So we try to work through them. But again, a small subset of people, no matter what we do, won't tolerate it. And that's okay, right? The medication's not for them and we stop. We're not here to just like continue it or push it on people.
So Nisha, I'm picturing this scenario, and I know when I in primary care for 16 years, I always see this all the time. So you have some patients that are all in, help me
Mhm.
understand what the tools are. I want to use all the tools. And then there's also some patients that say, give me the medicine and that's all I want. So how do you continue in your scenarios, especially with all your expertise, to bring in these other pillars of
Mhm.
wellness, the evidence-based nutritional information, the increased culinary literacy? How do you weave that in there to truly empower the patients to use all those tools that are available?
Yeah, I think it's important to also explain that, what we eat matters and that it's not just, again, always like going back to what I was saying, it's not just about the number on the scale, right? We want to make sure that we're eating for that term I always say, optimal cardiometabolic health, right? And it's very important. I mean, everyone's in different stages of change that they're willing to make. And I think we have to meet our patients where they're willing to meet us. And some people will be able to take bigger strides towards making lifestyle habits more upfront and they're able to do that. They have the time and the resources, the finances to do that. And then there are people that are not going to be able to take those big strides. So what can we do? Like I was recently just talking to a patient about, hey, let's pay attention to the added sugar line on some of these foods that you're eating, because we do want to make sure that we're still limiting the amount of added sugar that we're eating. I know, we're talking about medications, but this is still very important, right? Because we don't want people eating a diet, even on medications, that's higher in ultra processed, more calorie dense foods that are higher in sugar, salt, and fat. That's like the perfect combination that's very appealing to our brain. We still want to be able to get, the lean proteins, the plant proteins, the fruits, the vegetables, lentils, beans, nuts in moderation and seeds. All of those are so important. And this is where that culinary medicine aspects come in. Because again, these are minimally processed foods. You're not going to go eat raw kidney beans or raw pinto beans or something, right? Like we want to be able to flavor them and cook them. A lot of patients may not be able to tolerate certain foods like beans in higher amounts. So how can we help them prepare the food so that they can, soaking them overnight, using an Instant Pot? How are we going to flavor them? Are we going to put them into like an Indian dish? Are we going to make tacos? Like all of those things are really, those conversations are still really important. So I definitely emphasize what we eat still matters, because also it's going to be easier to stick to a healthier diet and a healthier weight when you're eating these foods. I go back to what I said, like no one's overeating broccoli, right? I mean, maybe there's somebody out there that's doing that, but I doubt that they are, creating a calorie increase with just broccoli alone. But let's find ways to make broccoli enjoyable. And my little one won't eat steamed broccoli, but if I saute it with some garlic, they'll eat it. He'll eat it. So it's really that same concept. Like you may not like steamed broccoli, but could you air fry it? Could you put it into a baking sheet, and like actually learning how to properly roast vegetables and not crowding the pan and making sure that you're using, the proper spices that are not going to burn like in the oven. So it's just, those things are still incredibly important. And I think that's oftentimes the missing piece of the puzzle when we talk about nutrition changes. I mean, we could, talk about what to eat, why to eat it, but it's the how am I going to do it in my busy life that people really struggle with. And how am I going to do it where it doesn't feel like a punishment? Because I mean, if you ate just like chicken and broccoli all day long, I think that would get old over time. So, like, how can we help you incorporate a variety of foods? That's still also very important, too, right? We want to make sure that we're meeting our nutritional needs by incorporating that variety of food. Also, respecting cultures and customs and family traditions and not demonizing somebody's food as unhealthy because they're of a certain culture. Like that's just not fair. We can all find ways to make our cultural foods more health promoting. I mean, there's a lot of vegetables that are native to the South Asian culture that I encourage my own parents to eat more of, or trying to help them get more of those on their plate. So incredibly important and definitely not a piece of the conversation that we should ever forget about.
Now, as we wrap up, I'm going to ask you, how do you
Mhm.
feel about Kennedy and his appointed role as Secretary of the Department of HHS?
Yeah, that's a really great question. As a physician, it is my goal and job to take care of a wide variety of patients, regardless of, what any type of political affiliations they have, and I will always stand by that. And it's the same thing here, right? Public health is not a partisan like issue. It's not a one political party versus another. We know that we have increased rates of cardiometabolic health conditions in the country. We know that we live in food environments that are really challenging to navigate. And I welcome meaningful changes that will help improve that food environment. Oftentimes, when we fixate on one ingredient or one specific aspect of food, we really don't drive like significant, meaningful change. We need to understand all of the contributors that make it difficult for people to, eat more healthfully, move their bodies, sleep. All of that is very important. There's a lot of different factors, but I do hope that we see some meaningful improvements in our food environment. It's too soon to tell. I think there's a lot of awareness about improving public health. It's just a matter of how well that happened. That's to be determined.
Now, as we're finishing, is there anything I didn't ask you or anything you want to share in this conversation that we haven't done so far?
Yeah, I definitely want people to think about their health and their well-being beyond just weight. It's really about. And often the term holistic gets thrown around. It's a little, like, oh, holistic well being, but it's really thinking about all aspects of your physical and mental well being. It's not just like I see patients that literally their lives change, right? They like set boundaries, they take care of themselves, they say no to things that don't serve them. I mean, that is a part of their health and well being. And that's something that I'd fully encourage and actually talk to patients about setting boundaries because every time they say yes to something, they're saying no to something else. And what are they saying no to? Are they saying no to their 20-minute workout after work? Are they saying no to, eating their health promoting meal that they made? So it's so important to emphasize that our well-being is just way, way beyond the number on the scale. It's all of these things that are so important because we want to live full lives. We want to live lives with purpose. And I tell patients, please separate your happiness from the number on the scale, from the weight, because you're allowed to be happy no matter what body you're in.
To finish, how can people find you, either social media or your practice, web?
Yeah, so you can find me on social media on X and Instagram at Dr. Plantel. It's Dr. Patel. So I love getting helping patients get more plants on their plate. So that's where that Dr. Plantel came from. Definitely do a lot of education and advocacy on my social media pages. And so definitely come check it out.
Wonderful. Thank you so much, Nisha. I've really enjoyed our
Thanks so
conversation
much.
and truly appreciate you.
Thank you.
I hope you feel motivated by this episode. Please leave us a rating and a review and mention our show to others who you think could use this information. That could be your doctor, it could be somebody who works in the food service industry who's interested in the health components, it could be a friend that is working on their health journey. If you want to hear more, please remember to follow Culinary Medicine Recipe on your favorite podcast listening platform. Until next time, salud and bon appetit. All content provided or opinions expressed in this episode are for informational purposes only and are not a substitute for professional medical advice. Please seek advice from your doctor or other qualified healthcare professional.
Fentanyl. It could be hiding anywhere, including in your house, including in your medicine cabinet, or maybe at a friend's house when you're hanging out, playing games, and get offered a pill. Don't take chances. If a drug didn't come from a pharmacy directly to you, you can find fentanyl using a simple strip you can pick up at your local pharmacy. Don't take it until you test it, because fentanyl can be hiding anywhere. Brought to you by the Georgia Department of Behavioral Health and Mental Disabilities.
Hello, it is Ryan, and I was on a flight the other day playing one of my favorite social spin slot games on ChumbaCasino.com. I looked over at the person sitting next to me, and you know what they were doing? They were also playing Chumba Casino. Everybody's loving having fun with it. Chumba Casino is home to hundreds of casino-style games that you can play for free anytime, anywhere. So sign up now at ChumbaCasino.com to claim your free welcome bonus. That's ChumbaCasino.com and live the Chumba life.
Sponsored by Chumba Casino. No purchase necessary. VGW Group. Void where prohibited by law. 18 plus. Terms and conditions apply.